What is listeriosis? Listeriosis is a foodborne illness caused by the bacteria Listeria monocytogenes. This disease can be very serious for pregnant women, people older than 65, and people with weakened immune systems. Listeria bacteria can also be found in soil, water, and animal feces, but it is commonly caused by eating improperly processed deli meats and unpasteurized milk products. Who gets listeriosis? Anyone can get listeriosis. Listeriosis is usually a mild illness for pregnant women, but it causes severe disease in the fetus or newborn baby. Some people with listeria infections, most commonly adults 65 years and older and people with weakened immune systems, develop severe infections of the bloodstream, causing sepsis, or brain, causing meningitis or encephalitis. Listeria infections can sometimes affect other parts of the body, including bones, joints, and sites in the chest and abdomen. How is listeriosis spread? Listeriosis is usually caused by eating food contaminated with Listeria monocytogenes. If infection occurs during pregnancy, Listeria bacteria can spread to the baby through the placenta. What are the symptoms of listeriosis? Listeriosis can cause a variety of symptoms, depending on the person and the part of the body affected. Listeria can cause fever and diarrhea similar to other foodborne germs, but invasive Listeria infection is rarely diagnosed. Symptoms in people with invasive listeriosis, meaning the bacteria has spread beyond the gut, depend on whether the person is pregnant. Pregnant women. Pregnant women typically experience only fever and other flu-like symptoms, such as fatigue and muscle aches. However, infections during pregnancy can lead to miscarriage, stillbirth, premature delivery, or the newborn having a life-threatening infection. People other than pregnant women. Symptoms can include headache, stiff neck, confusion, loss of balance, and convulsions in addition to fever and muscle aches. How soon do symptoms appear? People with invasive listeriosis usually report symptoms starting 1 to 4 weeks after eating food contaminated with Listeria. Some people have reported symptoms starting as late as 70 days after exposure or as early as the same day of exposure. Should an infected person be excluded from work or school? Listeria is not spread from person to person, so exclusion is not required. What is the treatment for listeriosis? Treatment involves antibiotics and supportive therapy. When infection occurs during pregnancy, antibiotics can often prevent infection of the fetus or newborn. What can a person or community do to prevent the spread of listeriosis? Avoid high-risk foods, including queso fresco and other soft cheeses, raw sprouts, melons, smoked fish, raw unpasteurized milk. Thoroughly cook meat, beef, lamb, pork, and wild game, as well as poultry, chicken, turkey, and duck. Wash raw vegetables and fruit thoroughly before eating. Keep raw meat separate from vegetables, cooked foods, and ready-to-eat foods. Do not allow the blood from raw meat to come into contact with other food. Use separate cutting boards for raw meat and foods that are ready to eat, for example, cooked foods and salads. Wash your hands before and after preparing food. Wash knives and cutting boards after handling uncooked foods. Wash your hands after handling animals. Perishable foods should be stored in a cold, less than 5 degrees Celsius and 41 degrees Fahrenheit, refrigerator and be washed and eaten as soon as possible. Resources: Centers for Disease Control and Prevention, https://www.cdc.gov/listeria/index.html